My name is Dr. Brandon Thornberry. I'm one of the veterinarians partnering with your veterinary hospital. I've got Leia here with me. I want to give an overview of a veterinarian's approach to a cat that is urinating outside the litter box or urinating inappropriately. It's a very common thing that we see in the veterinary hospital, and I know it's a frustrating thing for you all at home, but I wanted to give an overview from a veterinarian's perspective so that way you can ask really good questions to your veterinary team, and then we can get you the best care for your cat as possible. Everything starts off with a really thorough history, and this is no exception. So the acronym that I usually use is called DEMO. D stands for diet, so what diet is your cat currently on? E stands for environment, which is very important in a cat that's urinating outside the litter box. If there's been changes to the litter box location, if there's been changes around the house with furniture or new additions in terms of family members or other pets, that's also a very important part. M stands for medication, so any meds that your cat is currently on or maybe been given that's worked or not worked for this condition. And then O stands for other symptoms. So not uncommon for us to see a cat that's urinating inappropriately outside the litter box, but also having some trouble jumping or getting around. Or maybe the cat is also drinking a lot and urinating a lot as well. All these things can build a picture for where we take things next. Common groupings for why a cat urinates inappropriately are usually divided into the following. Pretty uncommonly, frankly, is a UTI. More common in our dog patients, but about 1 to 8% of cats urinating inappropriately have a UTI, so a pretty small percentage of cats end up having a urinary tract infection. The next most common grouping, about 20% of cats have what's called a bladder stone or a urolith. That's another common cause for a cat urinating inappropriately. And we'll talk about some diagnostics to rule that in or rule that out. The biggest grouping is what's called fluted or idiopathic cystitis, which means that they have bladder inflammation and we don't know the cause of it, which is a frustrating condition because we can't pinpoint the exact trigger for it, but there are treatment options available too. Common diagnostic tests we reach for with a cat that's inappropriately urinating are the following. The first is usually a urine sample. Everything flows through that very first test. We're screening for evidence of a UTI or urinary tract infection. We're looking for evidence of crystals, which are the building blocks to stones. That's usually where things start. The next common test, because 20% of cats end up having a stone as the reason for their cause, is to take an x-ray. We can usually lay our eyes on some sorts of stones that can sit in the bladder that we can't always feel or see on the physical exam. The next common test to really rule out a UTI, which can be a common cause, it's about 1 to 8% of cats can have a UTI, is what's called a urine culture. So if the urine sample looks negative that we initially ran, but we're convinced that there might be evidence for a urinary tract infection, we might advise for a urine culture that basically can grow the bacteria over a period of time and tell us what antibiotics to use. The last common part of a workup for a cat inappropriately urinating is blood work, for the reason being that especially if a cat has multiple symptoms beyond urinating improperly, we might reach for blood work to look at the kidneys, look at the liver, look at the thyroid levels, things that can all contribute to a cat that might be manifesting with urinating now outside the litter box. Treatment is always going to be best guided on what the diagnosis is. That's why we reach for these common tests, the urine sample, the blood work, the x-ray, the urine culture that can guide those treatment recommendations. For cats that are in this big grouping of idiopathic cystitis or just benign inflammation of the bladder, typically it entails doing a diet change that kind of resets the urinary tract environment. This condition can also be uncomfortable and painful, so we might do an anti-inflammatory to go home. And there's a number of options from liquids to chewables, sometimes even injectables that can be given. If a cat has a stone, there can be a combination usually of diet and surgery that are required. And if a cat has a urinary tract infection, there might be an antibiotic for a period of time administered too. And there sometimes are some options from oral chewables to liquids to injectables that can cover that because we know it's hard to medicate cats at home. So in summary, for a cat that's inappropriately urinating, it's really important for us to focus on the history. There's a lot that we can glean, especially from the environment, that could be triggers for cats inappropriately urinating. So the better we can understand the environment at home, the better we can do a really thorough physical, land on these diagnostic tests to guide our treatments, the better outcome for your cat. There additionally are some modifications that can be made at home for a lot of situations beyond just medication and dietary interventions. A lot of cats can feel a lot of comfort in making sure there's enough litter box access, or maybe changing the substrate of the litter to make it more accommodating for a cat to be going to the litter box rather than seeking out other sources. So your veterinary team will talk through some other non-medicated ways that we support cats that are inappropriately urinating.